We're going to take a few minutes to get you updated on the COVID-19 pandemic and the vaccination program underway. Joining us to do that is Dr. Lance Schupbach, a hospitalist with Bryan Medical Center. Doctor, thank you so much for joining us.
You're welcome, Dennis.
Well, some researchers have said it appears that most of the fall and winter wave of coronavirus infections has peaked and cases are starting to decline. We're starting to see some hospitalizations decline and hopefully eventually deaths will decline. But what are you seeing locally now based on what we've been through the past few months, what it's like now?
Right now, Dennis, we are seeing improved numbers from November, but I really hope the public does not relax what they're doing because all the sacrifices people have made have been key to helping us achieve some of that success. If anything, we need even more people to wear masks and physical distance whenever they can and not to relax. It's going to be a while before we can get the vaccine widely distributed enough so that relaxing our practices on masks can be permitted.
So nationally, there's been some criticizing of the vaccine rollout. Here in Nebraska, we've got about 115,000 vaccinations so far. That's a little over 1% of the 16 and older population that's eligible for the vaccine. So how smoothly are you seeing this process run at the local level?
Beginning in the middle of December, when I received the first dose of the Pfizer vaccine, the hospitals have done an incredible job of getting employees to get vaccinated, and the employees themselves, anecdotally, my friends and coworkers have just done a great job of getting the word out and sharing their stories. And so from that perspective, it's gone smoothly. I had wished that more of the community and the 1B, so to speak, the vulnerable elders and so forth had been vaccinated already, but I'm optimistic that'll speed up and that the general public won't have to wait more than 2 or 3 more months.
So as a doctor, what do you say to somebody who comes up and asks you, should I get the vaccine?
Most people have nothing to worry about with the vaccine. I had a little bit of soreness on my left arm where the injection was given, and the second injection was even less uncomfortable than the first one. Some people will feel feverish, they'll feel achy, and that may last a day or two. That happened to some of my coworkers, but the risk of serious side effects is very low. The worries some people have, myths about the vaccine changing their DNA and that sort of thing, are nothing to be worried about, and the benefits far outweigh the risks in that case.
And President Biden this week is calling for 100 million vaccinations in his first 100 days. He also wants more PPE, and so not from a political standpoint, but from a medical standpoint, is that doable?
I haven't looked at the numbers of what that would, that would be a heroic effort. I've heard, I believe on NET and some other news outlets about how quickly New York City got vaccinated against smallpox decades and decades ago when they had much more primitive ways of getting the word out and getting the vaccine administered. So I'm optimistic we can do it, but how realistic will it actually be, I can't say.
We want to take just a minute. If people have questions about the vaccines, there is a place that they can go.
My organization, Bryan Health, that's Bryan with a Y, health, one word, .org/vaccine, has information about the vaccine. Of course, the Department of Health and Human Services for Nebraska and the Lancaster County government both have websites with ample and correct information about COVID-19 vaccination.
Dr. Lance Schupbach, thank you so much for being with us on Speaking of Nebraska.
You're very welcome, Dennis. It's my privilege.
Appreciate it. You can follow the NET News team's coverage of the COVID-19 pandemic at netnebraska.org/coronavirus.